I'm Christine Thomas, a Cancer Support Navigator for the Urology team. The Navigator's main role is to be the first point of contact for the patients and their family members, answering any non-clinical queries and then triaging any clinical queries to the appropriate teams. We also offer holistic needs assessments, and that can identify any concerns that patients may have, whether that's practical, physical, emotional or spiritual. And then we can signpost to local charities and services, also referring to Velindre services as well, whether that's welfare rights or the therapies team for any symptom management. Patient-centred care is something we work with all the time, making sure patients are well informed of the treatment and diagnosis. My favourite thing about my job would definitely be the contact I have with the patients and their families, and being able to make a difference and offer the support and guidance whenever I can.
Hi, my name's Naomi Swan. I'm one of the urology clinical nurse specialists. As a clinical nurse specialist, our role is to support patients throughout their cancer journey. So we try and meet patients at their point of diagnosis, and then we support them through their treatments, and we try and support them then when they finish their treatment and go out into the community. I think patient-centred care is important because it allows patients to make individual choices about their treatment based on their personal circumstances. For World Cancer Day this year, I think it's important to highlight the roles of other people that help support patients during their treatment, which isn't necessarily clinical.
Hello, my name is Becca. I am one of the occupational therapists here at Velindre Cancer Service. Occupational therapists at Velindre are specialists in oncology and palliative care. We are holistic healthcare professionals who support patients at any point in their cancer journey. Occupational therapy uses a whole person approach to assess an individual's needs, exploring physical, psychological and social aspects to gain a full picture of their functional abilities and highlight difficulties affecting daily life. We look to promote independence through the use of daily activities and are guided by what a person needs and wants to do. In alignment with World Cancer Day, person-centred care is at the forefront of everything we do as occupational therapists, and a patient's values shape the care and support we provide.
My name's Sally Thelwell and I'm the Arts and Health Coordinator for Velindre Trust. So my role is to work with staff and patients to bring creativity and art into the hospital. Being creative is really good for patient and staff well-being. When you're taking part in an art activity, you know your head's down, you're focusing on what you're making, what you're doing, and it takes you away from your busy shift or your cancer diagnosis, and it allows you to focus on something else, to think about something else. For World Cancer Day this year, I think it's really important to focus on patient-focused care, because patients aren't just numbers, they're not just the illness, they are whole people, and I think arts and health allows us to really focus on people's well-being and support them in a different way.
Hi, my name's Katrin and I'm one of the clinical psychologists that work here at Velindre. Our clinical psychology and counselling service provides emotional and psychological support for anyone who is undergoing treatment. We help at any point during your treatment pathway. So some people come to us early on in preparation, and some come to us during, and some come towards the end or after the treatment has finished. Our clinical psychology and counselling service sits within a multidisciplinary team of services at Velindre, and we all work together to provide that holistic care. On World Cancer Day, we acknowledge that good person-centred care involves acknowledging the full person, not just the disease. And so that means taking into account the social context, your identity, your preferences, and to consider all of those things together to ensure that we deliver you the best care.